Hello everyone, and welcome back to another Facebook Friday. I'm Dr. Alan Van Scoyk, and once again I'm joined by Dr. Mina Botros, and we are not at the chiropractic company location in Glendale, but we are live outside of a school. This is Whitefish Bay High School, because we are now ready for part 2 of our back to school series. So last time we talked a little bit about what to do if your kid is not going to be at school but is going to be learning virtually. Today, what we're going to talk about is some chiropractic tips on what you can do to make sure that your child is well taken care of and your student is doing the right things to keep healthy if they are going back to school. So really, we can break down our goals in 3 different categories. The first category for us is really being prepared for school. Now, we talked a little bit about this last time, but it's really important for our students to be well rested. Sleep is such an important part of making sure that you can concentrate and focus and absorb all the information. So right now, it's important for our students to get back on that schedule. Summertime can be tough on getting out of schedule, like to stay up late, sleep late, and unfortunately, when that bell rings, you better be ready to learn. So now's the time to get on top of your sleep schedule. Second thing is, before you get to school, once again, it's important to have good, solid nutrition. You want to eat properly, have good fruits, proteins, make sure your body is filled with all the proper foods that you need to be successful. Now, a lot of the fancy diets these days talk about low carbohydrates, but your brain needs carbohydrates to function, just not only carbohydrates. So if you're only eating cereal, not really the best thing for you. You need to make sure that you're getting in some proteins, getting in some fruits. It's really going to help you throughout the rest of the day. There's another thing that we don't always talk about, but in the office we like to mention, and that's different supplementation that you can do to make sure that you fire it up at its optimum. Dr. Botros, tell us a little bit about some of the supplements that we could take to enhance some of the things that we're already eating in our daily diet.
So one of the supplements that's often overlooked by a lot of people, and when they are taking, it tends to be very poor quality, unfortunately, is omega-3 fatty acids. Now, this is something that we would encourage most people to take from a young age. Even if you're a college student or a graduate level student, it's extremely powerful on its effects to promote neurogenesis in the brain, to reduce inflammation in the body, in the joints, in the heart, of course, and helps with overall attention, focus, and memories. Now, fish oil is one of the most studied supplements out there, and we see there's constant repetitive studies showing that it has benefits from people who suffer from depression and anxiety, which unfortunately tends to be a lot higher during the school year, and also with things such as attention deficit disorder, ADD and ADHD. So usually for people who have ADD and ADHD, make sure you're getting that assessed professionally by your medical doctor or psychologist or psychiatrist. But also, fish oil has been shown to really help keep things under control, and actually if you are taking medication for that, fish oil has been shown to actually reduce the amount of medication you need to get a powerful effect. So this is a really important one, and one of the things we're going to be talking about today too is something a little different, which is how you have an opportunity to win a bottle of clinical grade omega-3 fish oil. Now let's talk about fish oils if you are already taking some. The thing you really want to be careful with is you want to be careful not taking fish oil that you're getting from a generic store or a generic brand like, Costco, Sam's Club, Walmart, online. You want to get clinical grade fish oil, and reason being is because with everything that we're doing to our planet and with the sea and the ocean, things can be a bit polluted, and we see that the fish on the surface of the water tend to get the plastics and the oils and things, and so that quality of fish is not good. And then the fish at the bottom of the sea and the ocean tend to get the heavy metals and the toxins like lead and mercury, and also not very good. So ideally you want fish oil that's derived from fish that live in the middle there. Salmon, omega-3s are excellent. Some of those fish there is going to be highest quality, it's not going to be contaminated, and so this particular brand Omniway that we sell in the clinic, very high potent dose, very pure quality. People don't typically get fishy burps from it. This equals about anywhere between 3 to 6 capsules that you would get from Costco anyways. And their reviews are just absolutely wonderful. So if you are taking a fish oil, I would consider trying maybe switching over to something a little better and seeing how that feels.
And we'll talk to you a little bit about how maybe you can get your hands on some of those just by simply watching this video.
Yes.
Next thing that we need to do is, now that we're prepared to go to school, now we need to actually make our way to school. So these days, a lot of our students we see walking around are loaded down with books and heavy supplies, especially on the first few days of school when you need to take everything in, get your lockers prepared. A lot of students are overwhelmed as far as their backpack is concerned. So we want to talk a little bit about backpacks and how to use them and what's good to keep an eye on as far as how your student is using them. When we look at a backpack, once again, backpacks come in all different shapes, sizes, configurations. We want to make sure that backpacks, when they fit, are as close to your spine as possible. We don't want them hanging backwards. We don't want them drooping down. We don't want them riding too high. We need them right next to your back in a position that's stable and supported to that mid and low portion of your back. We need to make sure that the straps are not just on one side, as I had before, but on both sides. We want to make sure that weight is evenly distributed not only to the back, but also to the shoulders and upper body. If someone's having issues and they're going to roll forward because they're just hunching too much to try to manage that weight, and that's going to eventually cause all sorts of damage. We already spend a lot of our time moving in this forward anterior posture, and so if that weight is once again contributing to doing that even further, like I said, we're just accelerating some of the bad habits that we have through school. Another thing that we want to do is make sure that the bag is not overly stuffed with too much heavy things. Dr. Botros knows that there's many studies out there that show that the weight of the backpack is incredibly important as well.
Absolutely. So a good general rule is you don't want your backpack to be more than 10% of your body weight. So that means if I weigh 150 pounds, we don't want a backpack that's more than 15 pounds. Now think of your kid who may be, anywhere between 87 pounds to 120 or even more. That's putting a lot of pressure, especially when it's the beginning of the year or during exams and finals times. A lot of books, a lot of pressure that's going to aggravate the low back, the mid back, and ultimately the neck, especially when they're in those positions in school for a long period of time and they're going to be more sensitive to that extra weight.
Absolutely. So there's different things that you can do. Break up the amount of books that are in the bag. Take a few today, take a few tomorrow. If you have the opportunity, many schools will allow you to actually keep books at home and keep books at home in your locker. You can sign up for those programs. Most schools have recognized that that's a very valuable thing to their students to be able to provide, and most schools have that option. So checking in on that can be really good at saving your child's spine in the long run. The last thing is, now that you've finally made it to school, now what are you going to do there? Now, once again, school is ripe with all sorts of opportunities for bad spinal hygiene. We talked a little bit about, in several of our other videos, which you should go check out, having good posture. Once again, Dr. Botros, we can't talk to them enough about this. Talk to us about good posture.
So good posture, it all starts, like Dr. Van Scoyk mentioned, making sure you're getting proper sleep, proper nutrient, because that's what the building blocks of maintaining proper joint and muscle health. But when you're in school, you want to make sure that when you're sitting, again, remember the 90-90 rule, right? The 90-90 rule, where you want to keep your elbows, your low back, your knees at a 90-degree angle, because that is the most neutral and healthy position to keep your spine, your hips, and your overall body in space for long periods of time. Now, if you are going to be sitting for more than 45 minutes, like most classes are, it's going to be a really good idea to make sure that you're stretching, that you're loosening some things up, that you get up from a seated position. We're both really big advocates of drinking plenty of water, and the upside to that is, as you're drinking plenty of water, you're hydrating your discs and your muscles and helping with your overall energy levels and hydration. You also do tend to go to the bathroom a little bit more frequently, which gives you an excuse to get out of your chair, get out of your desk, and to move around a little bit more.
Really important. And for our younger students, We talk about energy. They have tons of energy, and sitting for that period of time, they just simply can't do it for very long and still maintain a good focus. So for those younger students, really important for you to get up, burn out some of that energy. I know a lot of schools do simple yoga programs that they'll put on for like 2 or 3 minutes. They'll get up, move around, do jumping jacks, push-ups, something in between those learning periods of time, so that when they are now ready to do math or writing, that they're ready to focus and that energy's been burnt up. After that lesson, boom, you can do some more things for the next couple minutes, get that blood flowing, get that energy out, and then get down to focusing again. Many studies show that that movement, that mobility, that little extra bit gets the blood flowing, gets that oxygen moving back into the brain, and allows for you to focus even more. So once again, even when you're at school, find that time to get up, move around. If you're not able to go between classes, get up, stretch, get those legs moving, get that blood flowing for even just a short period of time. It'll make that learning experience that much better and effective. All right, so that's once again where we are as far as our lessons in regards to going back to school. Now we're going to do something a little different today, because we've really enjoyed all the feedback that we've had from all of our patients. And unfortunately, most of our patients give it to us in person, and sometimes they're afraid to necessarily write down a comment or share all their good questions with everybody. And we want to create a lot of dialogue with all of our patients and all the people that are watching these videos. So today, as Dr. Botros said, we're going to give you an opportunity to win one of these bottles of great omega-3 fatty acids. So what we want to do is, between now and our next Facebook Friday, which should be next week, we're going to take all the comments and we're going to take all the people that share our video, and we're going to do a little raffle off. And those people are going to be able to win a bottle of our supplement. So what you got to do, once again, comment, share our video, so that we know, like I said, that you're engaged, and all those other people that have been watching will get to see your comments as well. So once again, I'm Dr. Van Scoyk, and I'm along with Dr. Botros, and we will see you soon next week in our next Facebook Friday. Until then, please take good care of yourselves, and we'll see you next week.